Good morning everyone. Today's topic is Temporal Infratemporal Region Part 1. In this we'll be dealing with temporal fossa, its boundaries, contents, infratemporal fossa, its boundaries and its contents, then muscles of mastication and relations of some important muscles. So to start with, this is temporal fossa. This green colored structure is the temporal fossa. It lies on the side of the skull and it is bounded superiorly by superior temporal line. If you remember the osteology lectures, then this is superior temporal line. So superiorly it is bounded by superior temporal line and inferiorly it is bounded by zygomatic arch. So this area is temporal fossa. Talking about boundaries of temporal fossa, the anterior boundary. This is the anterior boundary. Anterior boundary, as you can see, is formed by two bones, zygomatic bone and above that frontal bone. So anterior boundary by zygomatic bone and frontal bone. Similarly, posterior boundary. These are the two temporal lines. The upper one is the superior temporal line, lower one is the inferior temporal line. So if you see posteriorly, this inferior temporal line continues as supramastoid crest. So posterior boundary is formed by inferior temporal line and supramastoid crest. Then superior boundary is formed by superior temporal line, inferior boundary is formed by zygomatic arch. So these are the four boundaries of temporal fossa. Floor of the temporal fossa is made up of four bones, the same bones that meet at terion. So those four bones are frontal bone. Here where my pointer is the parietal bone. This is temporal bone and this is sphenoid bone, greater wing of sphenoid. So frontal, parietal, temporal, greater wing of sphenoid. These four bones form the floor of the temporal fossa. Apart from this, temporalis muscle is attached to the floor of temporal fossa. Talking about the contents, as I've already mentioned, temporalis muscle is attached. So one muscle is there. This muscle is temporalis muscle. This is one of the content of temporal fossa. Then we've got arteries and nerves. This is middle temporal artery. Middle temporal artery. Then zygomatico-temporal artery and nerve. Zygomatico-temporal artery and nerve is the branch of zygomatico-temporal nerve is a branch of maxillary nerve, which is a branch of trigeminal nerve. But this middle temporal artery is a branch of superficial temporal artery. Then we have deep temporal, which are lying deep to the temporalis muscle, deep temporal nerves and arteries. So these deep temporal nerves are branches of mandibular nerve and deep temporal artery is a branch of maxillary artery. This is maxillary artery. This was external carotid artery. This is maxillary artery and this is superficial temporal artery. So deep temporal arteries are branch of maxillary artery and nerves are the branches of mandibular nerve. So these are the contents of temporal fossa. One muscle, that is temporalis muscle. Then we've got three arteries. Those three arteries from behind forward is middle temporal artery, then deep temporal artery and zygomatico-temporal artery, and two groups of nerves, zygomatico-temporal nerve and deep temporal nerve. So these are the contents of temporal fossa. Next structure is infratemporal fossa. As you can see in the image, it is marked by red dotted lines. This is infratemporal fossa. It lies beneath the base of the skull. It lies between the walls of the pharynx and ramus of the mandible. Here, ramus of the mandible has been removed. Medially, there will be wall of pharynx and laterally will be ramus of the mandible. Between these two structures lies the infratemporal fossa. Talking about boundaries of infratemporal fossa, you kindly see the pointer in the image. This is the infratemporal fossa. This whole structure is infratemporal fossa. So this is the anterior boundary of infratemporal fossa. Here will be the posterior boundary. This is the roof. This structure is the medial boundary. Lateral boundary has been removed. This is the cut portion of mandible, ramus of mandible. So ramus of mandible will be forming the lateral boundary. And there is no floor. Floor is open. So let us see the boundaries. The roof. Roof, as you can see in yellow color, it is formed by infratemporal surface of sphenoid bone. This is sphenoid bone. So roof is formed by infratemporal surface of sphenoid bone. Anterior wall is formed by maxilla. Posterior surface of maxilla. Lateral wall, which has been cut, is formed by ramus of mandible. Medial wall, the structures you can see here, this is the medial wall. So medial wall is formed by, this is the lateral pterygoid plate, part of sphenoid bone only, lateral pterygoid plate and pharynx. This forms the medial wall. Posterior wall is formed by tympanic plate and styloid process. So these are the boundaries of infratemporal fossa. Roof is formed by sphenoid bone, infratemporal surface of sphenoid bone, anterior boundary by maxilla, lateral boundary by the ramus of the mandible, medial boundary by lateral pterygoid plate and pharynx, and posterior boundary by tympanic plate and styloid process. Floor is open. Now the contents of infratemporal fossa. So in the contents of infratemporal fossa, we'll see muscles, blood vessels and neural structures. So in muscles, what all muscles will be there? 3 muscles are there. This muscle, if you can see, this is lateral pterygoid muscle. This is forming the content. Then this is medial pterygoid. The image that we are seeing is from the medial aspect, not from the lateral aspect. We are viewing the picture from the medial aspect. So this is lateral pterygoid muscle, medial to it or deep to it is medial pterygoid muscle. And there is tendon of temporalis muscle which is inserted onto fovea. So these 3 muscles will be seen as contents of infratemporal fossa. Now coming to blood vessels, so there will be 1 artery and 1 vein. If you can see this artery, this is maxillary artery, branch of external carotid artery. So maxillary artery, maxillary vein and pterygoid venous plexus. This will form the blood vessel content. The neural structures, in neural structures we've got 2 nerves and 1 ganglion. If you can see this larger nerve, this is the mandibular nerve. This entire is the trigeminal nerve. This is the first division of trigeminal nerve, second division, third division. This third division is the mandibular nerve. So one nerve is mandibular nerve, the other is this green colored structure. This is the chorda tympani nerve. Chorda tympani is a branch of facial nerve. So mandibular nerve, which is a branch of trigeminal nerve, fifth cranial nerve. Chorda tympani, which is a branch of facial nerve, that is seventh cranial nerve. These 2 nerves and 1 ganglion along this mandibular nerve, this is otic ganglion. So these structures are forming the contents of infratemporal fossa. 3 muscles, lateral pterygoid, medial pterygoid and tendon of temporalis. Blood vessel, maxillary artery and maxillary vein. Neural structures, mandibular nerve, chorda tympani nerve and otic ganglion. Now coming to the other structure of temporal infratemporal region are the muscles of mastication. So 4 muscles are there. One is masseter, the other is temporalis, which you've seen as content of temporal fossa. Then we've got lateral pterygoid and medial pterygoid. When this will contract, it will try to pull the mandible, leading to elevation of the mandible. So this elevates the mandible and the superficial fibers protrudes the mandible. Next muscle is temporalis. Temporalis is this muscle. This is fan-shaped muscle. It lies in the temporal fossa. Its origin is from the floor of the temporal fossa and temporal fascia. Insertion, you can see, is through a tendon. This tendon is getting inserted onto the coronoid process. This is the coronoid process of mandible. This is condyle. This is ramus and this is body. So this temporalis muscles tendon is getting inserted into coronoid process of mandible. Nerve supply is by deep temporal nerves. Deep temporal nerves are a branch of mandibular nerve. Then action, again it elevates the mandible and retracts the mandible. Third muscle is lateral pterygoid muscle. This muscle you can see, this is lateral pterygoid muscle. As you can see in the image, it has got 2 heads, upper head, lower head. It's a short, thick muscle having 2 heads. Origin of the upper head is from infratemporal surface of greater wing of sphenoid. This is greater wing of sphenoid and this is the infratemporal surface. So infratemporal surface of greater wing of sphenoid. Lower head originates from lateral pterygoid plate, lateral surface of lateral pterygoid plate. And both these heads get inserted onto pterygoid fovea, a depression in front of the neck of the mandible. This is mandible, this is its neck. This depression is known as fovea. So this lateral pterygoid muscle gets inserted onto fovea. Nerve supply is by nerve to lateral pterygoid, which is again a branch of mandibular nerve. Action is it depresses the mandible to open the mouth. So this is the only muscle of mastication which is depressing the mandible. It depresses the mandible to open the mouth. Everybody else, all 3 other muscles are elevating the mandible as in to close the mouth. This is the only muscle, lateral pterygoid muscle, depresses the mandible. Then it protrudes the mandible and at the same time it turns the chin to the opposite side as part of grinding movements. Last muscle is medial pterygoid muscle. Again it has got 2 heads. It has got a larger deep head and smaller superficial head. So origin of deep head is from the lateral pterygoid plate, but from the medial surface of lateral pterygoid plate. Lateral pterygoid muscle arises from lateral surface of lateral pterygoid plate. Medial pterygoid muscle arises from medial surface of lateral pterygoid plate. But both the pterygoids arises from lateral pterygoid plate. Then the superficial head, as you can see, it arises from tuberosity of maxilla. Both these heads get inserted onto the ramus of the mandible on the medial surface of the ramus of the mandible. If you remember, masseter was inserted onto the lateral surface of the ramus of mandible. This medial pterygoid is inserted onto the medial surface of ramus of mandible. Nerve supply is by nerve to medial pterygoid, which is again a branch of mandibular nerve. So all the muscles of mastication are supplied by mandibular nerve. These are derived by first pharyngeal arch, hence they are supplied by the nerve of first pharyngeal arch, that is the mandibular nerve. Actions of medial pterygoid are it elevates the mandible, protrudes the mandible, and along with lateral pterygoid, it turns the chin to the other side as part of grinding movement. So this is all about muscles of mastication. Now relations of some important muscles. One is lateral pterygoid muscle. It is the key muscle of infratemporal region. So its relations are important to study because it is a key muscle of infratemporal region. It serves as a landmark. These are the superficial relations. If we see from outside to inside, from superficial to deep, the superficial relations of this lateral pterygoid muscle are: most superficial structure will be the masseter muscle because it lies on the lateral aspect of mandible. Then will come your ramus of mandible, which is cut here. So outside that will be masseter, then ramus of mandible, then there will be tendon of temporalis muscle, and this structure, this is maxillary artery. So these four structures lie superior to the lateral pterygoid muscle. Most superficial will be masseter, which has been removed. Then will be this ramus of mandible, which again is cut. Then tendon of temporalis and maxillary artery and its branches. So these are the superficial relations. If we talk about the deeper relations, then we can see here. This is the lateral pterygoid muscle. Deep to it is mandibular nerve. Then middle meningeal artery. Middle meningeal artery is a branch of maxillary artery. This is external carotid artery. This is its maxillary branch, maxillary artery, and maxillary artery is giving a branch known as middle meningeal artery. So this middle meningeal artery lies deep to lateral pterygoid muscle. Then is sphenomandibular ligament. Here this is sphenomandibular ligament. This has been cut. You can see the cut portions of sphenomandibular ligament. And lastly, the deep head of medial pterygoid muscle. So these four structures are seen deep to lateral pterygoid muscle. First is mandibular nerve, maxillary artery, meningeal, middle meningeal branch of maxillary artery. Then we have got one ligament, that is sphenomandibular ligament, and medial pterygoid muscle. So these are the relations of lateral pterygoid muscle. Now the structures that are emerging at the upper border, here you can see these are deep temporal nerves. The deep temporal nerves are branch of again maxillary artery. So these deep temporal nerves and arteries emerge from the upper border. Then you can also see mesenteric artery, that also appears in the upper border. So we've got deep temporal nerves and arteries and mesenteric artery. Structures that are emerging at the lower border are lingual nerve, branch of mandibular nerve, inferior alveolar nerve, which is again a branch of mandibular nerve, and inferior alveolar artery, which is a branch of maxillary artery. This entire is maxillary artery and is giving off branches. So in lingual nerve, inferior alveolar nerve, and inferior alveolar artery. These three structures are emerging from the lower border. Structures passing through the gap between the two heads. So there are two structures that are passing through the gap between the two heads. One is the maxillary artery and the other is the buccal nerve. Maxillary artery enters through the gap, whereas the buccal branch of mandibular nerve, it comes out of the gap. So two structures are passing between the two heads of this muscle. One is maxillary artery, which is entering. Second is buccal branch, which is coming out of the gap. So this is all about the important relations of medial pterygoid and lateral pterygoid muscles. So that was about the relations of lateral pterygoid muscle. Now coming to relations of medial pterygoid muscle. Medial pterygoid muscle, the superficial relations is the lateral pterygoid plate, which is not visible here, but you can understand that lateral pterygoid plate lies superficial to medial pterygoid muscle because it arises from medial aspect of lateral pterygoid plate. Then there is this lingual nerve and inferior alveolar nerve. These structures are seen superficial to medial pterygoid muscle. This is the medial pterygoid muscle. These are the two heads of lateral pterygoid muscle. So deep to it, you can see these two nerves. So superficial structures are lingual nerve, inferior alveolar nerve, and lateral pterygoid plate. Deep relations of medial pterygoid muscle are the muscles that are lying on the medial side, that is the muscles of the pharynx and palate. Tensor veli palatini, superior constrictor of pharynx, and two muscles, one muscle going to the tongue, that is styloglossus and stylopharyngeus. So all these pharyngeal structures are seen deep to it. So this is all about temporal and infratemporal part 1. Remaining structures will be seen in part 2. Thank you.
Subscribe to my YouTube channel Meditate Literature Mandala and also hit the press bell icon whenever I upload my video get notified.